and so welcome to our March HPSI meeting. Today on our agenda, we are going to receive a COVID-19 update and have some time for questions and answers. We're going to hear from Dientes about the community dental care update and oral health access Santa Cruz report card. And we're going to start this morning with some partner check-ins. And kicking us off is Jenna Shankman, the HIP program manager, to kick off these check-ins. And we'll have about 15 minutes for these this morning. So Jenna, if you want to come on, kick us off.
Yeah. Thank you so much. Good morning, everyone. Thank you for allowing this time. So I specifically wanted to share, so I am currently managing our SafeRx program, and every other year we work really closely with the Public Health Department Substance Use Disorder Prevention Division to conduct a survey that looks at medication storage and disposal practices. And that really informs our work because we do a lot of work around how to dispose of medications and some communications about best practices for storing medications in the home to optimize safety and prevent that from being an unattended source. So when we conducted this survey last in 2019, we heard from the community that 55% had unused medications at their home, and 91% of those kept those medications stored in an unsecured way. And 25% of people were throwing medications in the trash, and close to 50% were bringing them back to pharmacies. And so some of the programs that we were doing at the time were fairly new. And so we're really interested in seeing what sort of shifts have happened since in that 2-year period. So that really helps us with our work. And we wanted to ask that if you could, I'm going to put the link in the chat. It's a short 5-minute survey. And we also have flyers available in both English and Spanish, and some sample kind of outreach language. And so if it works, I think we'll send all of those materials out with the notes. And so you can share them with your network. So this is just a quick peek of what the flyer looks like. That will let us get to the rest of the agenda, but it would really help us a lot. We have a goal of 800 responses, which is fairly ambitious to reach, but really important to be able to get a good picture of what's happening in the community.
Thank you, Jenna. Any questions for Jenna? Okay, so for those of us that have just joined, we're in the partner check-in portion of the agenda. And so are there any HPSI partners that would also like to provide an update or a check-in? You can unmute yourself and share or raise your hand. We're kind of scanning the attendee list for raised hands as well. And, oh, I see Sam.
Thank you for that. Good morning, Stephanie. Can you hear me?
We can.
Excellent. Good morning, everyone. This is Sam from Kaiser Permanente. It's a bit of a pre-announcement because the official announcement hasn't gone out yet, and will be going out shortly. But KP is partnering with the Santa Cruz Warriors to open up KP Arena as a mass vaccination site. That should be coming right around mid-month, a little bit past mid-month, past the 15th. But as we get more closer to it and we make the official announcement, we'll get more of the logistics information out to this group for dissemination, and also to the Warriors and all the different media channels that we have active. It will be open to both members and non-members. So it's open to the community for anybody who is eligible as of that time. And then of course, as vaccinations become more plentiful, we will continue to ramp up operations there. That's it for me. Thank you.
Thank you. Okay. Any questions for Sam or additional partner announcements? Oh, DeAndre, I see your hand is up.
Yeah, just also kind of a pre-announcement because I figure we have another meeting beforehand, but we have a fully healthy farmers market coming to the community in Ramsey Park out in Watsonville starting in April. And so it's one of the first of its kinds for this county, and it's been supported. Thank you, Central Coast Alliance, as well for that. And so we're excited about that opening up for the community for the food insecurity in South County.
Thank you. Do we have any other partner check-ins or announcements for today? I'm not seeing any. So I'll just give it another minute. We could be ahead of schedule, which would be fine, I think. Okay, well, let's move to the next item on the agenda. And then if we have additional time at the end of the meeting and someone has come up with a check-in, perhaps put it in the chat. And if we have time, we can get to those as well. But let's move on to our COVID-19 update, and Dr. Newell will be presenting to us.
Good morning, everybody. I hope you're feeling the hope and optimism that is spreading through the community. The news is really good and continues to get better. I love that announcement from Kaiser Permanente today. I know that their vaccine supply has gotten more plentiful, and we're very grateful to have them in the community and to be such a valuable partner. So let's take a look at what's happening with COVID. Next slide. Yep, so we're going to start with the global view, and this cases are still ticking up, but much more slowly. These are global counts from the Johns Hopkins dashboard. A year ago today, the World Health Organization declared the pandemic as a world emergency, a global health emergency. And I remember at about that time panicking because we had 13 cases in the state of California. And so we've come a long way since that time with now 29 million cases in the United States, 117 million worldwide. And the CDC tells us that for every known reported case, there are 7 to 10, depending on where in the world, cases that are not reported. So huge pandemic globally. And then of deaths, 2.6 that are known to be due to COVID. And in both cases and deaths, the US has owned about 20%, 1/5 of those throughout this entire pandemic. And we could talk about that for hours and why that happened and may or may not have been able to be avoided. Next slide. So here, a little closer in, the California statistics. And if you're a data geek and love to play with data, you can find dashboards like these on the governor's webpage at covid19.ca.gov. And what I want you to focus on is that purple curve and the black curve below. That's our COVID pandemic to date in a nutshell. You can see the small bump at the beginning was last summer's smaller surge, and then the big one was our holiday surge that started around the time of Halloween and started going down after New Year. And we are so fortunate that it's gone down even faster than it went up. Again, we could have a long discussion about why that may be happening. It may be partly due to vaccines, partly due to people not traveling and moving around as much as during the holidays. Maybe that this virus has a seasonal behavior and that we'll be back to a similar picture again next fall, but we certainly hope not. And we're seeing deaths fall at the same rate that we have been seeing the cases fall. So very happy about that. So that's the state picture. And then next slide. Here's what's happening with our state blueprint for recovery. The governor's project with colored tiers. And this is updated every week on Tier Tuesday. And on this Tuesday, we had the very happy news in the county of Santa Cruz that we went to red. And that increased our ability to reopen our economy somewhat. I tried to go to the movies last night, but there were no movie theaters open yet, but maybe by this weekend. And they can open for 25% capacity, indoor dining at 25%, retails up to 50%, gyms can reopen again, but only for 10%. We are required to stay in the red for 3 weeks. They try to limit movement so that we don't all lose our heads over the reopening. 3 weeks though, March 30th, I anticipate that we will be orange. And the governor has redesigned some of the tiering that's going to add a vaccine metric to that. And it's weighted toward those counties that have quartile 1 zip codes, lower healthy places index zip codes, and they will be rewarded for getting those populations vaccinated. So we'll see a lot more of the state go red and then orange and yellow. And the governor announced yesterday that he is currently working on the green tier. So that's all really good news. Next slide. So here's our numbers as of Tuesday. We are very close to orange metrics already, and we need to be in the orange metrics for 2 weeks before we can go orange. So the key number here, if you look at under county metrics, is that adjusted case rate for tier assignment, 5.3. We need it to be 4.9 or lower in order to go into the orange. And I think we'll get there easily. We've been dropping steadily with lower cases every day reported. And our positivity rates are excellent. Our overall positivity rate is in the yellow, and then health equity quartile in the orange. And all of this data can be found on our local website as well. That's santacruzhealth.org. Next slide. So some new things that have happened recently. We're seeing some movement, and these guidances, the blueprint guidance have been posted. So there's new guidance for outdoors, professional and college level sports with audiences that will begin on April 1, as well as other live performances like theater and concerts. So we know more about this virus now and know that we can, outdoors is safer than indoors. So that's where we're beginning to reopen larger gatherings. Amusement parks are eligible to open in the red tier starting April 1st. So I anticipate we'll see some of the rides at the boardwalk running beginning around April 1st, the end of spring break. I'm a little worried about that. But small capacity, 15% capacity with advanced reservations. And then the youth and adult sports was posted for 1 week. And then there was a legal settlement between the state of California and a sports entity in San Diego, which demanded a complete revision again. And so that was updated at the end of last week. It does allow some spectators huddled in households with face coverings on 6 feet apart. And then the new post-vaccine guidance from the CDC came out saying that small private gatherings of individuals who are fully vaccinated may happen without face coverings. So you can have your closest friends over for dinner if they're fully vaccinated. That means 2 weeks, a full 14 days after their final dose. And you can gather together and eat and drink together and not have your face coverings on, and do that with a good level of confidence. And there's some details to those, and the state is coming out with more detailed guidance as well about how we can gather together after vaccination. So far, it does not apply to workplace settings, and especially not healthcare workplace settings. Next slide. So here's what's happening locally. And again, you can find this at santacruzhealth.org. And you see our local virus curve looking very much like the states, with a small surge last summer and a big one over the holidays, and a steep decline, and that flat curve of the number of cases. So very, very happy news, better than I would have ever imagined. Next slide. So I'm going to go through these really quickly. But when you go to our demographics page now, you can choose between case demographics and death demographics. So you can look at age, and it's distributed by decade in a pretty predictable fashion with cases, knowing that our 20 to 29-year-olds are still most at risk for getting COVID. Next slide. And then this is how our death demographics look. And you can see that, of course, the older you are, the more likely you are to die of COVID. And also that our deaths are heavily weighted toward the Latinx population and toward those who are in nursing homes. And you can scroll through the nursing and residential care facilities and see how many deaths each has had. Next slide. And this is an equity slide, and we continue to see the Latinx population more heavily impacted than any other sector in our community. And the South County, although the Mid-County is pretty much caught up, but both South and Mid-County now have about twice the number of cases as you'd expect from their population, their proportion of the county. Next slide. So here's a more fantastic news, our case rate change. So green is good, red is bad, and we've had a good long run here of green. And all the models are predicting that it's going to stay down in this region. Of course, we've got a slow, we're nearing zero, but looks like we're not even going to have that little surge we were hoping to avoid at the end of March. Next slide. And this is the days since the number of cases passed 30 cases per 100,000. It's kind of a way to look at how each county dealt with COVID as it came along. And we were a very late riser. We stayed at the bottom for a long, long time. And I think that's because we were able to avoid outbreaks in our congregate living facilities, like the skilled nursing facilities. But once they took hold during that big surge, then we joined our neighbors, and we're sitting right where we would be expected to, right between our neighbors, Santa Clara and San Mateo. Next slide. And so all of the numbers are trending in the way we want them to go. Hospitalizations moving downward. We've been in the single digits for hospitalizations for a week now. So I never thought I'd see those days, and here we are. Next slide. Same with the ICU beds. So we have really good ICU capacity now in our hospitals. Next slide. And the death rate as well has gone way, way down. Next slide. This is the reproductive number. It's kind of tricky to explain, but more or less it tells us how good our community is doing, how well we're doing at transmitting disease or not transmitting disease to each other. We want this number, the reproductive number, to be below the 1.0. So green is good, yellow not good. And our epidemiology team is showing us here with these the tier colors on the bottom, that the tighter the tier, the better we behave, and that's understandable. But it's a reminder to us that even though we may not be in the purple tier anymore, we should behave like we are, wearing our face coverings and minimizing mixing and staying home when ill. And that's what keeps this number where we want it to be, well below 1. Next slide. So locally, what have we been doing? Well, we've been vaccinating, and we've been vaccinating so furiously along with our multi-county entity partners, particularly Sutter and Dominican Dignity have helped tremendously. I'm glad to hear Kaiser's going to get some more vaccine and be able to help too. And we have consistently ranked among the best per capita vaccination rate in the state. Really great partnerships and collaboration between all of you. So thank you so much. Some new news is we're really trying to get messaging out to the South County where there is more vaccine hesitancy. And we are now beginning a Promotora program through Salud para la Gente with other partners to send health educators, promoters out into the community to get that message out door to door, neighborhood by neighborhood about the importance of vaccination. We still haven't reached many of our elders. About 20% of our 75 plus have not yet received their vaccine, even a first dose, and about 30% of our 65 and up. And that's the most vulnerable population. So we're really focusing on them. We are onboarding with MyTurn, the state-led online portal for registration and scheduling. And we will be going live at the end of the month. And that will mean that your patients can sign up, or your friends and family, on myturn.com. And when it's their turn, they'll actually be able to go online and find a place to schedule their appointment for their vaccine. And lastly, we are onboarding with our third-party administrator that you've probably heard so much about, Blue Shield. And we had our first meeting this week, and I'm a Blue Shield skeptic, but I feel like it went really well and that things are moving in the right direction using that TPA statewide for a more unified approach. Next slide. This is just another dashboard from the governor's webpage, and you can look and see how many vaccines have been administered, and you can look by county, and there's lots and lots of detail available to those of you who like to play with data. But California has vaccinated over 10 million folks now. That's over a quarter of our population. And so we are between the number of cases and the number vaccinated. The state thinks they're on track for reaching a level of herd immunity that may be impactful by late spring. Next slide. So who can get vaccinated now? Well, this changes almost every day as the governor responds to political lobbying and advocacy and other forces. And we were told that after phase 1B that there would no longer be any more phases in California. But we keep getting more and more folks added. We started with these 3 occupational groups that are listed there. The county vaccine started going to them. And then prior to that, even Dominican and Dignity and had been able to get to some of these groups as well. So the original occupation-based groups for vaccine were limited to agriculture and food. In our county, that's almost 40,000 people. Education and childcare, and we've gotten all of the K through 12 educators, including staff, who want vaccine. And then emergency services, law enforcement. And we're well on our way to making a big dent in this population. Next slide. And here, oh, you can see the numbers, sorry, agriculture and food, 33,000, emergency services, 6.7 thousand, education and childcare, 8.3 thousand. And the state is allocating vaccine according to these percentages. So the state is estimating how many more of these we have to do, and then sending vaccine in these proportions. Next slide. So this week, the governor announced that there would be several new sectors added to this scheme into the current phase. And we have not seen these groups posted unless it happened overnight. But next, also eligible will be these occupations: all public transit workers, that includes airports and airport service staff. They're eligible for vaccination now. All janitors, housekeepers, cleaning services in all sectors, all disaster service workers who've been activated to respond to any kind of emergency, and a disaster service worker, for those of you who don't work in government, every single government entity employee is a disaster service worker. So that's a large number as well. And then MyTurn, the state announced that anyone who works in a MyTurn MassVax clinic on a volunteer shift is also eligible. We have not instituted that yet in our county. And then starting on Monday, there's 4 additional groups that are eligible: those who are experiencing homelessness, the incarcerated, those with high-risk medical conditions, and staff serving in these congregate living settings. Next slide. Then there's also a vaccine equity measure that's just been added to vaccine allocation. We've been focusing on these areas, which are the blue areas on the map. This is the Healthy Places Index, and you can find out more about what that means, but over 25 different factors are weighed into the decisions about who's most vulnerable to this disease. And so we've been focusing mostly on the Watsonville area east of Highway 1, and then 2 small areas, Beach Flats and Live Oaks. Probably not a surprise to any of you. Most of you work in these areas as well. And so we've been focusing efforts on these census tracts. Well, when the state announced their Healthy Places Index metric to the tiering process, they announced that 40% of vaccine would be going to the lowest quartile. But when we got the list from the state, they used zip codes and not census tracts, and we have no quartile 1, Q1 zip codes. Most of the Bay Area has no Q1 zip codes. So heavily weighted toward getting vaccine into the Central Valley, the border counties like Imperial, and East LA, the Inland Empire area. From a state perspective, it's probably more equitable. From a local perspective, it may mean that we get lower allocations for a while. Next slide. I'm almost done, but I wanted to remind you that you can tell your patients, your friends, your families, that there's 2 important ways to engage with us until we're fully on board with our TPA. One is if you're part of an organization that has not yet had vaccines offered to your employees, please sign up on the Vaccine Interest Survey. You'll get these slides and can link to it, but that is also found on our vaccine page at santacruzhealth.org. And it will allow you to enroll your organization to get your employees vaccinated when it's your turn. And we're hand managing that list at the county. And then individuals should sign up on My Turn, and the link is there, but it's easily found online. And then the individual will be notified when it's their turn, when appointments are available, and when and how to schedule. And we'll be fully live on My Turn at the end of the month. Individuals are also encouraged to talk with their medical provider and their employer about whether or not they have other options to get vaccinated. And last slide, next slide. Just a reminder that even when you're fully vaccinated, we want you to continue to follow these guidelines for the most part. We still have a lot to learn about the virus, about the vaccine, about variants, which I didn't mention yet, and to stay home if you're sick, to keep washing your hands, keep that social distancing going, and your face coverings on. I will mention the variants. The state is testing some of our samples and UC Santa Cruz is also running, doing genomic sequencing on most of our samples. I can tell you that preliminary data from UC Santa Cruz shows that most of our cases are what's called the California variant. It used to be called the Los Angeles variant. It does seem to be slightly more transmissible and maybe a bit more lethal than the standard COVID-19. But the good news is that we don't have any of the 3 so far variants detected in our community. So the B117, the B1351, and the P1, otherwise known as the British, the Brazilian, and the South African, those have not been detected in our community in genomic sequencing so far. So that sums it up for me, but I'm happy to take questions. And it's a lot of information, so this was a very brief overview.
Thank you, Dr. Newell. Because we're so ahead in the agenda, we do have time for questions. And I'll just, if I could just start by saying thank you for the thorough update. It was really impactful for me to see kind of the reflection on where we've been and where we are today and where we might be going. We've all been in this space for over a year together, and yeah, I'm feeling cautiously optimistic by the glimmer of hope that this update offers. It's been such a difficult year for so many people for so many reasons. And so just wanting to start with an offer of gratitude for the work of you and the county team and all of the providers in the community for really working so hard over the past 15 months to keep us safe and to navigate all this data and to make good decisions to move things forward. I know there's a lot of work that remains, and it's, I'm cautiously optimistic, but it's a good thing to hear and really impactful to see where we've come from. There's a lot of questions in the chat. And so I guess we could start with those, and then people can perhaps raise their hands and we'll just make sure we navigate through. Let's see. So Leslie had put some information in the chat about UCSC sequencing the virus from samples and that there wasn't a variant present in that analysis. I don't know if we want to say more about that or let that comment stand. Next, Larry was asking about context for the misgivings around Blue Shield and, how is Santa Cruz County looking at the TPA versus the concerns that have been expressed by Santa Clara County?
Well, I think anyone on this call who's been a provider with Blue Shield understands my misgivings. I would say their values lie with profits over health. And I know that the media has published this week that the person overseeing this project is currently earning $3.5 million, their CEO. It's a little disheartening when we're trying to serve the most vulnerable communities to be working with an entity like that. But I do think that we've had a very messy process with vaccination, with so many decisions, far too many decisions lying locally, and that the state really needs to have a more unified approach with the ability of locals to tailor it according to specific needs for their own community. I know that my concerns are shared by health officials, public health officials around the state. Largely, our concerns are focused on an entity like Blue Shield having the vision to be able to serve vulnerable populations, to move beyond the talk of equity into the walk of equity. And but I really do see that they're making an effort. The counties that they're onboarding with, appropriately, I believe, the Central Valley, and then moving through the Southern California counties next. They're working out the kinks for us, so it'll be smoother by the time they get to us. We do think we'll be fully onboarded by the end of the month. And I think that will offer pros and cons, but it's inevitable. We don't have a choice. The Santa Clara news was from their county council that they're not going to sign the contract, and neither are we. The only county that has signed the contract with Blue Shield, it's a completely unsignable contract. It's with demands and responsibilities that we could never meet and liabilities that we can't accept. And so in the meantime, I think that whole process of that contract with Blue Shield is getting abandoned because only one county, Kern County, has signed out of 61 local health jurisdictions. And so it looks like that's going to be replaced with an MOU between the counties and the state, and that's going to serve the purposes. So Santa Clara will join, we will all follow Santa Clara's lead. They've just gotten the most publicity and been the most vocal, but that will be solved with an MOU with the state instead. So it's good that the governor's office recognized that. As far as the equity concerns around zip codes rather than census data, there's pros and cons to doing that too. I can say that I think that's going to be fairly short term. We're halfway already. We're almost at 2 million doses in those Q1 zip codes, and that was the first goal, with the second goal being 4 million doses into those zip codes. And once that happens, I think that equity, that part of the allocation will be abandoned. So we're halfway there already. I'm not too worried about that. And I think vaccine will become abundant by the beginning of April, and that this kind of squabbling will hopefully go away.
Can I just follow up to that question in terms of the TPA? Because what we're aware of in Merced County is that much like how Santa Cruz has approached pulling together providers to talk about who has capacity to administer the vaccine, and there's really been some, as there typically is, strong collaboration across the partners in the county to make sure that there's a system for delivering the vaccine. It seemed like the barrier to vaccine was supply and not coordination. And as the TPA has come in and they're really talking with the county about the plan that the county had already prepared and how to lift that up to the TPA so that the TPA can execute it. And so in these conversations, do you anticipate, if the counties aren't executing a contract, but it's an MOU, will there be a further shift with the TPA, or is your sense that the administration is very committed to utilizing the TPA?
I think the TPA, the biggest concern they're addressing is around data. So each time the state has had to go back to the feds to try to advocate for more vaccine coming to California, the feds say, we're not going to give you more because you have 4 million sitting in the state already. In actuality, that's not true. It's that the state data systems are so antiquated, they haven't been able to keep up with the rate at which we're putting shots into arms. And so it's a data lag situation. And so that's become more and more clear through state level meetings, is that the problem isn't that the locals weren't getting shots in arms. It's that the state system wasn't able to keep up with the data in order for us to continue to get more vaccine from the feds.
Thank you.
It's a problem of our disjointed healthcare system.
Yeah. Okay. DeAndre had a comment or a question about letting anyone who wants the vaccine get it. And so I don't know if there's any further information about a broader expansion that you want to comment on.
That's our hope, is that by late spring, that there will be such abundant supply and we will have vaccinated so many people already that it'll be open to all comers. And then we'll be begging people to take vaccine.
Yeah. A question about, do the variants show up on PCR testing? Also, do they show up on the Abbott Binex Now cards?
The only way to see variants is to do full genomic sequencing, and that's from PCR testing. So it's further testing on those PCR samples.
And then Larry had a comment, the census tract versus zip code issue is why local healthcare leaders need to be directed to get this work done and perhaps not ask a for-profit health plan to make decisions. That is all of the items in the chat. Are there any additional questions for Dr. Newell? I'm not seeing any in the chat. I'm going to check hands raised. Just appreciation expressed for your hard work, Dr. Newell. Okay.
The partnership in this community is just phenomenal. The willingness and ability to collaborate and work together and not competitively has been phenomenal. We're so fortunate to have had the MCEs, Kaiser, Sutter Pamp, Dominican Dignity, and their ample supply of vaccine. So we got a real leg up on vaccination in our community through those. And a special thanks to HIP and your team, who have really made the collaboration possible through conversations all week long, every week, week after week through the last 15 months. So thank you all.
Okay, well, thank you. And we are going to move to our next agenda item. And Laura and Dr. Seppi will be presenting on the dental care update and the 2021 report card.
Thank you so much, Stephanie, and thank you, Dr. Newell. It was amazing to hear the progress that's been made, and I, like all of you, I think I'm feeling positive and optimistic about this new year. So I guess I should put my glasses on so I can actually see you guys. I am Laura Marcus, CEO of Dianthus Community Dental Care. And with me today, I have our amazing clinical leader, Dr. Seppi Tagvai, who is Dianthus Chief Dental Officer. Today, I'm going to start by providing an update on how Dianthus has weathered the COVID pandemic over the past year. Then I'll do a brief review of the outcomes of Dianthus Vision 2020, the strategic plan we developed in 2012. Finally, I'll share with you our plans for 2021 and beyond. Next, Seppi will provide you an overview of the work of Oral Health Access Santa Cruz County and the recently published 2021 report card. In closing, I'll provide some information about how you can support access to oral health through new federal and state legislative efforts. And afterwards, and actually throughout, there's opportunities to ask questions. It was 12 months ago this week that the CDC neglected to recognize dental as an essential service when society was shut down in response to COVID-19. In addition, federal relief funding for providers was not offered to dentists. That was a very difficult time for Dianthus. All of our staff were furloughed. We were only seeing 10% of our normal patients, and we were losing $200,000 per week in revenue. Although we had reserves in place, they were designed to carry us through a few difficult months, not a year or indefinitely. So we were forced to lay off some positions permanently, and we cut $1 million from this year's budget. Perhaps the decision with the greatest long-term impact, we reached the conclusion that we needed to eliminate the second floor administrative offices we had planned to build at the site of our new clinic on Capitola Road. In the end, I'm confident that this was the right decision as it cut $2.5 million from our construction budget and allowed us to focus on fundraising for operations. And my admin team's been successfully working remote since last March, and we plan to continue to operate this way. Thanks to the vigilance of our operations team in implementing COVID safety protocols, we were able to reopen in May 2020 at about 60% capacity and slowly ramped up to 90% by the end of the year. This is in comparison to dentists nationwide who are still serving less than 70% of pre-COVID patients. I'm also proud to report that although we've had a few positive cases in our staff, even with 90 patients a day and 30 staff at our largest location, we have not had a single COVID outbreak at any of our sites. After dental was listed as essential, we were awarded federal funds in the form of grants and 2 PPP loans, which we hope will be forgiven later this year. In addition, our fundraising team did an amazing job finding new grants and funding sources to help us. I want to use this opportunity to thank so many of you here today who provided support and resources to us through direct contributions, grants, and vaccine distribution to our staff and patients. I'm happy to say that Dianthus weathered this very challenging time successfully with only a $50,000 loss in fiscal year 2020 versus the $1.6 million loss we were anticipating. And I think this reflects the adaptability of our strategies and the effective decisions of my team and board. So now a little reminder of where Dianthus came from. Most of you know we started in 1992 as a volunteer effort to provide dental services to people living with HIV. With a clear demand for services from a broader population, Dianthus grew to providing care at multiple small clinics across the county. By the time we reached our 20th anniversary in 2012, we'd maxed out our clinical capacity with 7,000 patients in 20,000 visits at one consolidated location on Commercial Way in Mid-County, which I think most of you have been to. In 2012, Dianthus board and management team developed big, audacious goals for our Vision 2020. These goals included expanding services, doing more education and outreach, providing care to more kids, developing dental-specific quality metrics, and growing our partnerships and our fund development programs. I'm happy to report that through multiple expansion efforts, we've increased the number of patients we served from 7,300 to 11,500 in fiscal year 2019, an increase of 58%. Dental visits also increased dramatically by 106% to over 40,000 in fiscal year 2019. Education is so important, but always hard to find resources for. Our board dedicated significant revenues to our education and outreach program, which provided oral health education to 6,000 people and on-site dental care to 800 kids at 26 schools across the county in fiscal year 2019. Our expanded pediatric program, which includes 2,400 square feet of dedicated clinical space for kids at our Commercial Way location, has increased the number of children we serve to 5,500 in 2019, a 45% increase from 2012. Dianthus also established a quality committee made up of dental professionals inside and outside our organization who set quality and patient care goals and track these measures on a quarterly basis. In addition to clinical measures, Dianthus conducts a third-party patient satisfaction survey on an annual basis, regularly scoring above 90%. Expanding partnerships has been a focus of ours, and in addition to our work with schools in the outreach program, we're providing dental services in a co-located 5-chair clinic with the County of Santa Cruz in Watsonville. We have a 1-chair clinic on the Housing Matters campus and provide care in various other settings, including this year at the fairgrounds to serve victims of the Santa Cruz fires. We also partnered with Salud to transition their Beach Flats clinic to Dianthus in 2017 and are serving just over 1,000 patients annually in the 3 chairs at that site. Our final goal in Vision 2020 was to increase our fundraising revenues to 10% of our growing budget. We've had the great fortune of adding an experienced fundraising leader to our team in 2013, and our fundraising revenues have grown from $200,000 a year to over $800,000 in fiscal year 2020, a 300% increase. During the same time frame, our fundraising team also raised $4 million for our pedo wing expansion and adult clinic renovation. And most recently, we've raised $6.6 million for our newest site on Capitola Road. I don't want to move on to the future before I recognize the great advances we've made locally for oral health access through the strategic partnerships with the county, First Five, the County Office of Education, and many other partners, which Seppi will be talking about. In fact, oral health access has been identified as a strategic priority in countywide health improvement and strategic plans. Considering where we were just 10 years ago with oral health still considered outside the realm of overall health, I'd say we've made a lot of progress. Excuse me. Dianthus is currently working on our next strategic plan. This time, instead of a long view, our last plan covered 8 years, we're taking a short-term approach, recognizing how things can change a lot in a small amount of time. Our goals will take us through 2023, and our largest focus will be to continue to expand services through multiple partnerships, as well as a new heightened focus on workforce development and retention through an equity lens. I think you're all aware of the new project we're developing in partnership with Santa Cruz Community Health and Mid-Penn. The project at 1500 Capitola Road is a health and home campus in the heart of Live Oak, with 57 units of affordable housing, a 20,000 square foot medical center, and Dianthus 11-chair clinic, which will provide up to 6,000 new patients, both adults and children, dental services in a beautiful new facility opening in July 2022. Another new development in downtown Santa Cruz called Pacific Station, which will be adjacent to the Metro, is planned to house a new co-located clinic with Santa Cruz Community Health, along with retail and affordable housing. Dianthus hopes to provide dental services to up to 2,000 new patients at that location by 2024. Finally, we're also in discussions with the county to add dental services at their Emmeline clinic. I'm happy to answer any questions that you have, and then I'm going to pass it off to Seppi to talk about the movement that we've started with Oral Health Access Santa Cruz County. Seppi, you want to go ahead?
Hello, good morning, everyone. Thank you so much for having me. I'm so excited to be here. I'm here to give you an update on behalf of the Oral Health Access Steering Committee, or OHA. As you may know, Dientes founded OHA in 2016 in response to a first ever oral health needs assessment in Santa Cruz County. Dientes commissioned this report, and when we got the data back, we realized really quickly that the need is just too great and we're not going to be able to address it alone. So we put together a local coalition of stakeholders from our community to form OHA with the goal of improving access to dental care. The OHA steering committee includes members from various fields in our community, including public office, First Five, Office of Education, the Alliance, medical and dental safety net clinics, PVCHD, social services, and many more. And of course, HIP. And some of you who are here on this call are members of OHA, and I want to thank you so much before I get into more details. So we've been meeting since 2016 quarterly to work on our strategic plan. And for the last couple of years, our work has been supported by the County Oral Health Program and Prop 56 funds. I have to say that I'm super proud of the work that we've done. We have a steering committee that's super engaged, and they have great ideas, and we've made amazing progress. Last month, I presented, along with my fellow OHA members, an update on our report card, our 2021 report card, and I'm here to present that data to you today. But before I get into that, let me talk to you a little bit about that needs assessment that made us take action and form OHA. This report told us, for example, that out of 80,000 patients on Medi-Cal, only 25,000 were accessing the dentist. The reason for that was that no private practices were accepting Denti-Cal, and also the safety net dental clinics were at full capacity. 31% of the children in our county had never been to the dentist, and 24% had untreated tooth decay. And also seniors on Medicare did not have any dental insurance. So OHA came together with the goal of creating a measurable and actionable strategic plan that would have a real impact. The plan was kind of based on the premise that you don't have to be a dentist to make an impact on oral health. And as I go through our progress, you're going to see that it's really true. You don't have to be a dentist to make an impact. Our goals included promoting a First Tooth, First Birthday campaign, encouraging kindergarten oral health screenings, and expanding treatment, prevention, and clinical capacity. Next slide. So since 2016, like I said, we've been meeting quarterly. We've had a lot of momentum. We've had a lot of great discussions. In 2018, we produced a report card to show our progress. And again, like I said, we produced another report card in 2021. So I'm going to get into the details of that now. So as you know, our first goal was to promote a First Tooth, First Birthday campaign. Medical and dental experts recommend that a child gets a dental visit by the time they're 1 or by the time they have their first tooth. This helps us focus on prevention and parent education and hopefully prevent dental decay to begin with. So as this was one of our goals, this is a really great example of collaboration in our community. A lot of OHA members came together to make this happen. We launched a robust First Tooth, First Birthday campaign in 2016, and we've really continued that momentum. Some of the example of the work that OHA has done includes First Five did First Tooth, First Birthday flyers in all of their baby gateway packets. The County Health Services Agency did radio, print, and social media ads. Sometimes I'm driving and I'm listening to the radio and I hear like one of our ads coming and saying, if you have a child, take him to the dentist by the time they're 1 or when they have their first tooth. And it just makes me so proud. I hope you've heard those too. And then we also did some really targeted social media advertising based on location. It's a little big brother, but for example, if you were taking your child to the local pediatrician and you were browsing Facebook, all of a sudden you might get an ad saying, hey, take your child to the dentist by the time they're 1 or by the time they have their first tooth. So some really targeted and smart advertising. And then we included First Tooth, First Birthday flyers and toothbrush kits for pregnant patients through the comprehensive prenatal services. And the Alliance did First Tooth First Birthday newsletters a few times for patients and providers. And of course, Dientes and Salud, we made sure that these patients, when they were trying to get in, we made exceptions and we got them in. So this is the amazing result of our work. And I'm sorry if I sound really excited, it's because I am. Compared to 2014, we went from 16% of children on Medi-Cal accessing the dentist all the way to 52% in 2018. That's just amazing. And you might think that this is not just OHA and there might be a statewide trend happening, and you're right. But statewide, they've gone from 18% to 28%, and we've gone to 52%. So way to go, OHA. Our second goal was to encourage kindergarten oral health screenings. With this goal, we wanted to make sure that kids had a dental home before they entered public school. Of course, the goal is to reach them, when they're 1, but if we miss them this whole time, then we really want to make sure that they have a dental home by the time they get to kindergarten. And we partnered up with the Office of Education. Next slide, please. And our local schools committed to including the oral health screening forms in the enrollment packets for all kindergartners. The county oral health program helped promote these visits. Prima talked to the school nurses, and we really got their partnership. And then, of course, again, Dientes and Salud para la Gente, we committed to getting these patients in. When somebody got a call and said, hey, I need to come in, my child is going to kindergarten, we need a dental checkup and cleaning, we got them in right away. Okay, here's another amazing piece of data. Since 2014, we've gone from 39% of 3 to 9-year-olds accessing the dentist to 70%. That's just amazing. That's a 79% increase. And during this time, the states started at 54% and they went to 62%. So we've made just a huge leap above and beyond the state. And our last goal was to expand prevention, treatment, and clinical capacity. This goal has 3 parts. With the first part of the goal, we wanted local pediatricians and family doctors to apply fluoride varnish at medical well-child visits for children 0 to 5. Fluoride varnish is just a really easy way and effective way to decrease dental decay by up to 40%. It takes like 30 seconds to apply it. You just put it on your finger and rub it all over the teeth. It's super easy. Some of the work that OHA has done in achieving this goal in the last 4 years include the County Health Services Agency purchased fluoride through an oral health grant and distributed to the clinics in our county. Dientes, Cabrillo, and the county worked together to train medical providers and their staff on fluoride varnish application. I've done a few of these trainings myself where I would go in and talk to the doctors and their medical assistants and teach them how to apply fluoride, and they've been super interested and really excited to do it. And then the Alliance added fluoride varnish at medical visits as an incentive in 2020 to encourage providers to participate. And as a result of that, we've seen a 229 increase in application of fluoride varnish by medical providers. So if you're here and you have a team that's applying fluoride at medical visits, thank you so much. If you don't know how, let me know, I'll come teach you. And the second part of this goal was to make sure that our safety net clinics, Dientes and Salud para la Gente, were expanding their capacity. The Salud para la Gente committed to hiring more mid-level providers, such as dental hygienists, and they've done that. And Dientes committed to continuing our clinic expansion. So like Laura said, we added a 3-chair clinic in Beach Flats in 2018. We added a lot of outreach sites, mostly schools, to our outreach program. And then last year, we added another chair in our Watsonville clinic. So as a result of Salud and Dientes' efforts, our visits have gone up 51% since 2014, and our patients have gone up 30% since 2014. And as Laura mentioned, we're also expanding into Live Oak, and we're building a new clinic, and that's super exciting. Next slide. So, as you heard, we've made a lot of progress, but we still have more work to do. This is where we are right now. Out of 78,000 patients on Medi-Cal, 27,600 are accessing the dentist. We've made a lot of progress with kids, but adults are still not accessing the dentist as much as they should. For example, only 25% of patients 19 and above are getting access to dental care. This doesn't even include seniors on Medicare who don't even have dental coverage. Medicare does not have dental coverage. Another problem is that silver diamine fluoride, a breakthrough and conservative treatment to stop the progression of decay, is not covered by Medi-Cal. And then, of course, we have the impacts of COVID on access to oral health care. Like Laura said, capacity has been reduced. Our school-based dental clinics have been closed because schools aren't open. And no matter how much we tell our patients that it's safe and we've put extra safety protocol in place, there's still some of them are afraid to come in. So there's a lot of work to do. For those of you who are OHA members, I want to thank you so much, and for your great work and your continued commitment. For those of you who are not, if you're interested in becoming an OHA member, please reach out to me. Or you don't even have to be an OHA member. If you want to learn about how to incorporate oral health into your program, please reach out to me and I'll be so happy to help you. Thank you so much. Let me see. Okay, I see I have some questions. That's so funny, Keisha. I love it. Is there a plan to work with water system for fluoride? Oh, DeAndre, I wish. So the next phase, OHA, we're going to start meeting again later, I believe this month, and we're going to start talking about the second set of, the next set of our goals. So what goals do we want to accomplish? Adding water to our fluoride, in my opinion, would be the one thing that we could do that would have the highest impact in our community when it comes to reducing decay. But unfortunately, it's also going to be the hardest. We've tried this before and it didn't go that great, but DeAndre, you're a member of OHA, so we'll talk more in our next meeting, but I would love to make that happen. Okay, so if we don't have any more questions for this segment, I'll go to the next one. Next slide, please. Okay, I wanted to talk a little bit about workforce development. As you just heard, there's a lot of need in our community to increase access to dental care. So Dientes is having a lot of plans to grow in order to respond to this tremendous need. But one limiting factor is availability of workforce. I don't know how it's going with your medical clinics, but unfortunately, dental workforce is really hard to recruit. And it's become even harder with COVID. For this reason, at Dientes, we're really focusing on workforce development as a strategic initiative. So I'm going to tell you a little bit about just a couple of slides about what we're doing and our plans for the future. So staff development. For the past few years, we've partnered up with local dental assisting schools and also Cabrillo Dental Hygiene Program to host interns. We do this for dental assistants, for front office, for hygienists, and which we started up more recently. Hosting interns and students enables us to, first of all, introduce the future workforce to the wonderful world of community dentistry. A lot of them have no idea what it means to work in a clinic. They think it's like a dingy, dirty place, but they come in and they're so pleasantly surprised, not only by how clean and modern and updated our facilities are, but by the rewarding aspect of working with our patient population. So we get to train them, we get to embed our mission and vision into them, and hopefully recruit them when we have openings, which we're gonna have a lot of openings coming up. Some of our best staff have come from these internships. When I was doing some research with our long-term staff members, I found out that a lot of them have started out as interns. One of the programs we're most proud of is the sponsorship of our existing registered dental assistants for an extended program that allows them to become an RDA EF or an RDA with expanded functions. And EF is kind of like a mid-level provider in dentistry. It's a newer thing. It's been around for about, I believe, 7 years. And what we do is that we pay for half of the tuition expenses of the 9-month program in exchange for a 3-year commitment. So far, we've sponsored 5 EFs, and this year we're sponsoring our 6th. This program is so great because our staff gets to grow, they get to earn more money, they get to become a provider, while we get to increase access to care to our patients, and we also get to retain our amazing staff. These 2 wonderful ladies are Esther and Ceci, 2 of our EFs who've been with us for 15 years or more. And coming soon, we're exploring becoming a dental residency program in collaboration with NYU Langone. NYU Langone is a great program that has sites all over the country. This would be a 1-year residency program for dentists. Just to give you a little background, residency for programs for dentists are not mandatory at this time. I think they should be mandatory, but they're not mandatory. In California, they're really popular because it's a pathway to licensure. So instead of taking a practical test that's super stressful and you have to pay patients to participate, you get to go work in a clinic for a year and learn more clinical experience. Again, with this program, we would get to train the future workforce, provide care at reduced cost, and hopefully recruit these providers. And right now we're in the initial stages of exploring the program, but we hope to host our first 2 residents in 2022, so next year. And then it's just never a dull moment at Dientes. These are two of our wonderful dentists having fun on Give Kids a Smile Day last year. Okay. That's all I have. Let me see if I have any other questions. Oh, thank you, Gail and Monica and DeAndre. Thank you. Yes, staffing in healthcare. I think you're right. It's a big challenge, but we have to start the work now because we have so many plans to grow and we need to, set ourselves up for success, and we need to start now. Yep. Okay, thank you so much for having me. If you have any questions or if you want to participate in OHA or if you want to incorporate oral health into your programs, please reach out to me and I'll be more than happy to help you. Thank you.
Thank you, Seppi, and thanks everybody. I hope you're as excited as I am. It's so great to have a vision and dream about really incorporating oral health in all parts of our county and many organizations, and we have really made a lot of progress. It's really exciting. So this brings me to our last slide, and it's actually really exciting. There's a lot of optimism around increasing oral health access through new federal legislation, which might actually have a chance to pass because of the new administration. So I've been working with a national group called OPEN, Oral Health Progress and Equity Network, to lobby elected officials, including Senators Feinstein and Panetta, Speaker of the House Nancy Pelosi, and others, to support bills to add dental benefits for seniors in the Medicare program, to mandate adult benefits in the Medicaid program, and to ensure more federal support goes to oral health programs at the CDC. We're going to be sending an email follow-up with the 1-page fact sheet, and our hope is that you and HIP can sign on to support these measures. And we're also eagerly awaiting news on whether state Prop 56 funds will be used to support increased access to oral health beyond 2021, which is the current sunset date of the program. These Prop 56 funds have provided $1.2 million to Dientes since 2017 to support prevention services and continuity of care for our patients, and another $1 million to the county to run oral health access Santa Cruz County. I think you can skip this slide, Paul. Yeah, so thank you all so much again for your time and attention. I do want to announce that we'll be sending out save the dates for our Capitola Road groundbreaking, which is scheduled for Saturday, May 22nd. We hope to see you there. It will be an in-person event, socially distanced. And also, of course, next year, as we open our new clinic, I hope you'll all join us to celebrate the grand opening in conjunction with our 30-year anniversary. And just one last note, I mean, I really, as I was, putting the statistics together in these slides, I really feel so much gratefulness for the partnership in this community, which, we really could not have achieved what we have without all of you. And just, who would have guessed that a little dental clinic that started with volunteers in 1992 would grow to soon serve close to 20,000 people with high quality and comprehensive dental care and impact the oral health of thousands more people in our community. So thank you. And if you have any questions, feel free.
Thank you for this update. What a nice way to end, although we may have additional comments and questions, but to cap off the update we heard from Dr. Newell with some more optimism and success and showing what hard work and collaboration can yield for the community. It's just really inspiring. So thank you for that today. It was needed and I appreciate it. I'm wondering if there are any other questions or comments. I know there was a lot in the chat that you were able to address, but I'll just pause for a moment and see if anybody else had any other questions or comments. And seeing none, I'll go back to the early invitation at the beginning of the meeting if there are additional partner check-ins or announcements, because in rare form, we're early today. We have 19 minutes left. Jen Hastings, did you have an update that you wanted to share?
Hi there. Can you hear me okay?
Yep, I can hear you.
Great. Good morning, everyone. Thanks for what an inspiring morning. So the Calciano Symposium is tomorrow, and you can still sign up, register if you're interested. The day should be quite extraordinary. We have two leaders in the field of trauma and youth, Dr. Bruce Perry and Dr. Martha Merchant. It will not be recorded this year at the request of Dr. Perry. We're figuring out if we can maybe do the sections that he's not involved with, but I encourage folks who have interest in this area to join us. So just Google Calciano and the registration link is there. Thanks so much.
Okay, thank you. Are there any other updates or announcements? I'm seeing heads shaking. And so I will remind everyone that our April meeting is on April the 8th at 7:30 a.m. And we will look forward to seeing you all then. Have a great day. Thank you.
Thanks, everybody.
Thank you.
Thank you. Bye.